DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. Have a great show for you today. We're going to start talking about down cattle. We're going to talk about causes of down cattle and different things associated with the clinical signs. Stay tuned.
In the last 3 years, we've changed some things in our AI protocol, one of which was the use of multi-min. We've seen a significant increase in our AI pregnancy rate. The cost of an embryo program is significant, and we feel that if we were able to even get one more pregnancy out of a cow, that would pay for the whole cost of the whole bottle of multi-min right there.
This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University, and this is the first of a three-part series where we're going to discuss central nervous system disorders that lead to down cattle. We're going to talk about the potential treatment and care of those animals in the second segment, and the third segment is going to be when these treatments don't work and we have to humanely euthanize an animal. So I think it's really important because the down cow or the animal with central nervous system disorders has been in the media. It seems to be the thing that we see when we have mismanagement of these down cattle, winds up on video clips and undercover video clips. And I think it's very important not only for producers to understand what causes down cattle, how to properly treat these downed animals, and how to humanely euthanize them or make the decision to humanely euthanize them, but it's also important for consumers to understand that we have syndromes and illnesses and different things that go on within cattle that are similar to what go on in humans. And when we think about the downed animal, we have two types of downed animal, an alert or morbid downed animal. And an alert downer is one that is alert to its environment, can sit up, can drink and eat, and a morbid one is that's out flat and it's non-responsive to its environment. So when we think about treatment, we'll think about those two. But let's talk about the causes of what potentially may cause a non-ambulatory animal or cause an animal to be ataxic or not be able to, to stumble or cause blindness. All of these central nervous disorders or peripheral nervous disorders can be an issue. The central nervous system is made up of the brain and the spinal cord, and then the nerves that come out from there to the limbs and to the visceral organs are what we call peripheral nerves. And as we have bacterial, toxic, or toxin ingestion or consumption, or if we have injury to an animal, all of these can damage nerve cells, whether it's in the central nervous system or whether it's within the peripheral nervous system. Regardless of where the lesions are, all of these types of issues have the potential to cause an animal to be non-ambulatory or not be able to stand up or not be able to move or walk appropriately. And these animals must not enter the food chain. These animals that are non-ambulatory through the Downed Animal Act cannot be dragged, cannot be transported, and these animals by law do not enter the food chain. The issue that we have is identifying and preventing the causes of these issues. We also need to understand how to treat these animals so that they can recover, and then what happens when it doesn't go right. As we move through these segments and as we talk today, we're going to talk about bacterial and viral infections that can cause downed animals. We're going to talk about ingestion of potential toxins, and these aren't like toxins like that you'd think. We're just talking about sulfur, lead, and salt. And then the last thing we're going to talk about today is potential injury. When we come back in the next segment, we're going to talk about treatment and intensive care, and we're sure glad you joined us. This is an important subject for all of us to be aware of, and I think it's something that's valuable for the producer, and I'm glad we're going to be able to share it with you. Thanks for watching, and I'll see you here after the break.
There's something wrong. His head is down. He's clearly stressed. He's worried sick about BRD. That's why there's prescription Zactran for BRD treatment and control in high-risk cattle. Get a rapid response plus 10-day treatment and control in a single dose, so you can stop worrying and get back to business. For use in cattle only, do not treat cattle within 35 days of slaughter. Because a discard time in milk has not been established, do not use in female dairy cattle 20 months of age or older, or in calves to be processed for veal. The effects of Zactran on bovine reproductive performance, pregnancy, and lactation have not been determined. Don't worry yourself sick. Talk to your veterinarian about a real alternative for BRD treatment and control. Because it's critical, it's Zactran from Mariel, a leading animal health company.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Hi there and welcome back to DocTalk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. As we left for break, we were discussing the causes of central nervous or peripheral nervous system disorders in cattle. And the two biggies on the infectious side of things that I want to discuss are Histophilus somnus and Listeria monocytogenes. Now, when we talk about Histophilus, and you think, well, what's Histophilus? Histophilus, for most producers, they'll be familiar with the term Haemophilus somnus. And Histophilus somnus is the new name for Haemophilus. And when we think about Histophilus or Haemophilus, generally we think of that as a bovine respiratory disease pathogen. However, Histophilus can also cause joint ill in calves and cause lameness in calves, but it can also cause central nervous system disorders in the brain through thromboembolic meningioencephalitis. Now that's a mouthful. But what TEAM is a plaque or an embolism of the Histophilus bacteria on the brain level, which can elicit clinical signs such as salivation, ataxia, and cause the animal to go down, and it can cause moribund animals or death. And the other bacteria that we want to talk about that can cause central nervous system disorders is Listeria monocytogenes. And Listeria, you'll know the kind of the layman's term for Listeria is circling disease. Listeria is a gram-positive bacteria that grows in the soil, that also grows in the in rotten vegetation such as old hay or can grow in some improperly fermented silage. And Listeria on circling disease will cause a plaque on the brain on the left or the right side, and whichever side that plaque or infection of Listeria forms, the animal will circle towards that side. Listeria in later forms can cause the animal to go down and be morbid. Now, where is Listeria? We talked about it being in the silage, being in old hay, but it a lot of times can be in a silage pit. And Listeria doesn't happen very often, and I haven't seen very many cases, but whenever we do, and we go to the silage pit to try to find the Listeria, we don't tend to find it. Part of the reason is that within the silage pit, you can get air pockets or pockets where we get improper fermentation. Within that, when we don't get proper fermentation, is when we can get pathogens like Listeria to grow instead of the good bacteria that are fermenting the feed. And when we go to test for it, what I think happens is that we feed through that pocket of Listeria, And by the time we realize we have a problem, we're to the part of the silage pit that was properly fermented. So it's really important for the prevention of Listeria to make sure that we have proper fermentation, we make sure we have good moisture levels on that silage, make sure we get a good anaerobic pack so that we get a good fermentation within the silage pit. As we move forward from some of these infectious agents, and of course with infectious agents, when we talk about treatment, we're going to talk about some antimicrobials that can treat these problems. When we come back from break, we're going to start to talk about some of the toxins that could cause central nervous system disorders, which then potentially lead to down cow. You're watching Doc Talk, and we're sure glad you joined us.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi folks, it's Dr. Dan from DocTalk. Thanks for joining me for today's On the Farm tip. We're going to talk about extra labeled drug usage. Labeled drug usage is when I pick up the bottle, there's a label on it. And when I look at the label, it's going to tell me how much to give, how often, and the route of administration. Route of administration might be sub-Q, IM, or intravenous. Now, anytime you change the route of administration, or if you change the dosage, or you change the time in which you give those drugs, that's called extra label drug usage. We can't do that without the written consent of a veterinarian. So we need to follow label directions. If we don't follow label directions, we can wind up with antibiotic residues in the meat. And so when we do an extra label drug usage, we need the veterinarian involved. Thanks for watching today's On the Farm tip. I'm Dr. Dan, and I'll see you down the road.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
All the advice I'd give anybody on using Multimin 90 compared to any loose mineral or any other mineral that's out there on the market is Multimin 90, you'll see a result. There's no ifs, ands, or buts about it. You're gonna notice within about the first 7 to 14 days that their hair is gonna start shining. You're gonna notice that their noses will stay wetter. They're gonna feel better. You'll notice a little glow to their eye. You can just tell. Their appetites are better. It's a simple fact, it works.
This segment is brought to you by Double D Family Mat Shop. Injured livestock could mean injured profits. Protect yours with no-slip mats from Double D Family Mat Shop.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine. We've been talking about things that can potentially, whether it's infectious, toxins, or injury, cause a down cow or a central nervous or peripheral nervous disorder. And we talked about bacterial causes. Now in this segment we're going to talk about some of the toxic issues. And we think about toxins, it's not like chemical substances. We're thinking about naturally occurring elements such as sulfur and lead and salt. Let's start out with sulfur. Polioencephalomalacia is a syndrome that we term polio in calves, and polio issues can stem from one of two things: either a decrease in thiamine, which is a B vitamin, or an increase in sulfur or sulfate ingestion. Cattle produce B vitamins on their own through rumen microbes in the rumen. And so generally we don't supplement thiamine, which is a B vitamin, to cattle because they're producing their own. However, if we have an acidosis issue or a rumen dysfunction issue, where we don't have microbial fermentation at a high enough level, there could be a potential decrease in thiamine production. But most of the polioencephalomalacia, the cases that we see, are due to increase in sulfur ingestion. And that can be from water, which we measure the sulfates. It can be through feed products that have high sulfur content, or in the use of byproduct feeds that we feed with the distillers grains and some of the gluten feeds. We have elevated sulfur levels within those feedstuffs. Now, polio issues occur more in the summer than they do in the winter, spring, or fall, especially if we have high sulfate levels in the water. This is due to the fact that cattle drink 5 times their dry matter intake in the summer, and they drink 3 times their dry matter intake in the spring, winter, and fall. So the increased drinking intake, water intake of cattle in the summer can cause more polio issues to erupt in the summer. Make sure you check the sulfate levels of your feed. Make sure you check the sulfur levels of your feed. Make sure you check the sulfate levels of your water, and work with your veterinarian to make sure you aren't creating these types of issues. Lead toxicity. We seem to see lead toxicity in cows out on pastures, and when we see that, the 2 main culprits of the sources of lead are, 1, unused oil or leftover oil that cows get into, or a battery. Cows tend to go to a junk pile and they can sniff a battery out from a mile away, and I don't know if it's the sulfuric acid from the battery or what, but they like to lick them and chew on old batteries. And the clinical signs, one of them is to find the cow dead. The other one is a cow that's salivating, one that's constipated. It can cause GI issues, it can cause central nervous system issues, but one that's not walking appropriately, one that's moon gazing or over salivating. These are common clinical signs of lead toxicity. In feed yards, we want to make sure that we don't use lead-based paint when we paint pipes. Cattle will chew on pipes, they can get flakes of lead-based paint. And remember this, that if you have a cow or a steer that succumbs to lead poisoning, those animals need to be condemned, and they don't enter the food chain because of the lead toxicity. Get your veterinarian to help you diagnose it, though, to make sure that you know what you're dealing with on these. And as we come back from the break, we'll wrap up with a little bit of the toxins, and we'll move towards some of the trauma issues on down cows. You're watching DocTalk, and we're sure glad you joined us.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
This is Agriculture Today from Kansas State University. Alfalfa growers in the Central Plains routinely combat a notorious insect pest, the alfalfa weevil. Springtime insecticide treatments against the weevil are pretty standard, but K-State's Jeff Whitworth is now testing out the merits of spraying in the fall as well.
The alfalfa weevil feeding damage is compressed into a very short period of time, and 100% of the fields in Kansas are needing treating at the same time. So if we can maybe spread that out, do some of them in the fall, some of them in the spring, it would take some of the pressure off the applicators, take some of the pressure off the fields, the alfalfa fields. I just think it's something that we need to do.
This is K-State Research and Extension.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Baytra 100 Enrofloxacin injectable, now approved by the FDA for BRD metaphylaxis and high-risk cattle. Ask your veterinarian about Baytra 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Baytra 100, right the first time.
If our local animal agriculture industry disappeared, what else would disappear? The buses that get us to school? The playgrounds and ballparks we go to after school? The books and computers that help us learn and grow? Animal agriculture provides millions of dollars in tax revenue. that pay for our school improvements, that pave the foundation that will build our future. A message from U.S. soybean farmers and their checkoff.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here at the College of Veterinary Medicine, and we're talking about the downed animal and problems with the central nervous system disorder. One of the toxins I failed to mention was salt toxicity, and salt toxicity can be created when an animal consumes salt without having a hydration or being able to use the water supply adequately. And we need to make sure that animals know where and how to get a drink if we're going to be providing free choice salt. Some of the things on trauma, and I have some of them written down here, that I want to talk about that can cause an animal to go down, but the number one is calving. Okay? Cows that have trouble delivering a calf normally or need assistance in delivering a calf can sometimes go down in the back end. And the reason why this happens is the pelvis canal is made up of bone. And there's no give to bone. And so if we have too big a calf or too small a pelvis, we need to be working with our veterinarian. We need to be looking at doing a cesarean section, because if we have too much pressure of a hard pull of bringing that calf through that pelvic canal, we have obturator nerves that come from the spinal cord that go out the bottom of that pelvis through the obturator foramen. The obturator nerves are the nerves that cause the innervation or the movement of the hind limbs. When we get too much pressure of a hard pull from a calf going through that pelvic canal, we can cause disruption of the obturator nerves, and that's when we get those cows that go down in the back end. And some of them, through tincture of time and some treatment, can rise again, but some of them never get back up. Really focus on making sure that you have enough room if you're going to pull these calves yourself. And the other one, if you have any question, make sure you get your veterinarian on the farm to help you make that decision. Banding calves sometimes can cause a central nervous system disorder called Clostridial tetani. And tetanus, as what we know. And we really need to make sure that when we're banding calves, that you vaccinate the calves or use an antitoxin for Clostridium prior to banding, when we band to castrate these animals. And the last one is severe lameness. And this is the thing that a little bit of lameness left untreated or not looked at with that cow can turn into severe lameness, which can then cause that animal to become non-ambulatory. Get on top of lameness cases right away. Get your veterinarian involved. Understand what's going on. Pick that foot up. Understand if it's foot rot, toe abscesses. It could be founder. Any of these types of things can lead to severe lameness, and we need to make sure we get on top of these either on your own through diagnosis and treatment, but definitely consult your veterinarian. Thanks for watching DocTalk today. I sure hope you enjoyed the show. Remember, we always want you to work with your local veterinarian. Also, if you want to know more about what I do here at K-State, you can find me on the web at www.vet.ksu.edu. Also, you can learn more about DocTalk if you go to www.doctalktv.com. Thanks for watching the show. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. Thanks for joining us, and I'll see you down the road.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
We do use Multimin in our cow herd, and we're finding that there is a benefit. Seems like those cows breed back better. And we also found that by giving our bulls a shot of multi-men just before we turn them out, we really get a kick out of that. I've definitely recommended multi-men to several people, and it's a good product.